So different types of hysterectomy and the jargon that the gynecologists usually use can be quite confusing. So first of all, we have total hysterectomy versus subtotal hysterectomy. Subtotal hysterectomy is also called supracervical hysterectomy. A total hysterectomy is when the neck of the womb has been removed as well as the body of the womb. So the uterus and the cervix have been removed. That makes it a total hysterectomy. That has nothing to do with whether or not the ovaries have been removed or not. A subtotal hysterectomy is when we leave the cervix behind. It can be done in patients with very large fibroids, for example, but when endometriosis and pelvic pain is the indication, we normally remove the cervix as well. So we normally do a total hysterectomy in those situations. So that's total versus subtotal hysterectomy. And then we have radical hysterectomy. That's usually done for cancer. For benign indications, we normally do either a subtotal or a total hysterectomy. And then you have subtotal laparoscopic hysterectomy or open hysterectomy or total laparoscopic or robotic hysterectomy. That just tells us what the route of approach has been. The ovaries usually come in a separate addition when we say what operation has been done. So for example, we say total laparoscopic hysterectomy and bilateral salpingo-oophorectomy. Bit of a tongue twister. So salpingo-oophorectomy means removal of the tubes and the ovaries. Bilateral means both sides. So if we've done a total laparoscopic hysterectomy and bilateral salpingo-oophorectomy, it means that we've removed the uterus, the cervix, both tubes and both ovaries. If we say bilateral salpingectomy, that means that we've removed the fallopian tubes but not necessarily the ovaries. So the name of the procedure tells us what has been done, how much of the uterus has been removed, and what's left.